Assalamualaikum and hi. So today we will explain about corneal ulcer. Have you heard about corneal ulcer? As its name, corneal ulcer is a disease that affects the corneal layer, the clear outer layer of the eye. As you can see, this is the cross section of the eye. You can see the perfectly shape of the corneal layer, and this is the corneal ulcer where cornea having the sore. What is the causes of corneal ulcer? Actually, there's a few causes that can affect the corneal ulcer, such as sleep with contact lens, infection, exposed to bacteria, fungus, virus or parasite, and acanthameba. This is an example of situation how corneal ulcer can occur. Let's watch it. Wait. Now I will ask Brother Hilman to explain more detail what is corneal ulcer is all about.
Cornea is a transparent dome which covers the outermost layer of the eye. Its function is to reflect light into the retina. Corneal ulcer or infective keratitis is an inflammation of the cornea secondary to infection. It is a serious eye disease because it can lead to permanent vision loss. The cornea can be infected once there is presence of small corneal wound or injury. The infection can spread deeper into the cornea, which may cause blindness or loss of the eyeball. In 1996, National Eye Survey reported that corneal ulcer was the fourth cause of blindness in Malaysia.
Wow, fantastic. Now I would like to call Brother ADIB to explain what is the sign and symptom of corneal ulcer.
Corneal ulcer is a serious problem which can lead to blindness if treatment is delayed. Superficial examination of the eye may only show injected conjunctiva, tearing or edematous cornea. It is difficult to see subtle pathology of the cornea surfaced by torchlight or direct ophthalmoscopy examinations. Therefore, all patients who are suspected of a corneal ulcer should be referred to ophthalmologists for a complete eye evaluations. Corneal ulcer is best visualized with a slit lamp microscope after the cornea is stained with fluorescent dye. Among other findings seen in contact lens user is a giant papillary conjunctivitis, keratoconjunctivitis, punctate epithelium erosions, epithelium splitting, punctate staining by soft contact lenses, corneal stray, corneal wrinkling, and corneal neurovascularizations. Visual acuity of the patient must be documented as a part of the evaluation of the progress following treatment. So what are the symptoms of corneal ulcer? You may notice signs of an infection before you are aware of the corneal ulcer. Symptoms of an infection include: the first one is itchy eyes, second one is watery eyes, another one is pus like discharge from the eye, burning or stinging sensation in the eyes, red or pink eye, sensitivity to light. Symptoms and signs of the corneal ulcer itself include eye inflammations, sore eyes, excessive tearing, blurred visions, white spot on your cornea, swollen eyelid, pus or eye discharge, sensitivity to light, feeling like something is in your eyes, which is a foreign body sensations, and all symptoms of a corneal ulcer are severe and should be treated immediately to prevent blindness. A corneal ulcer itself looks like a gray or white area or spot on the usually transparent cornea. Some corneal ulcers are too small to see without magnifications, but you will feel the symptoms.
Oh my god, I don't want to get blindness. May I ask, Brother Hilman, what is the prevalence and the incidence of the corneal ulcer?
Now, let's talk about the incidence and prevalence of contact lens-related corneal ulcers. The incidence of microbial keratitis is approximately 2 over 10,000 per year for rigid contact lens user, 2.2 to 4.1 over 10,000 per year for daily wear soft contact lens, and 13.3 to 20.9 over 10,000 per year for extended wear soft contact lenses. In Malaysia, it was reported that 78.9% of contact lens-related corneal ulcer has positive organism culture. In another study, it was found that 78.1% of the corneal ulcers were colonized by the gram-negative bacteria. Keratitis, the precursor to corneal ulceration, is responsible for approximately 1 million clinic and emergency department visits a year in the United States. Corneal ulcers affect all groups but are much more common in those who wear contact lenses, especially extended wear lenses. A retrospective chart review from California found the highest rate of bacterial corneal ulcer was in females aged 25 to 34 with incidence of 60.3 per 10,000 person year. Estimates of the incidence of ocular herpes infection run 5 to 20 cases per 10,000 per year in developed countries. Of these infections, the causative agent is herpes simplex virus 1 over 95% of the time. Only 1.3 to 12% of the cases are bilateral, and this infection tend to occur in younger patients and be more severe. Fungal keratitis is rare but more common in young male outdoor workers. Fungal keratitis is also more common in the developing world and incidence varies widely with climate. In the UK, a study found the incidence of mycotic keratitis to be 0.32 cases per million person year. However, in tropical and subtropical environments, fungal keratitis may account for up to 50% of the all infectious keratitis cases. Peripheral ulcerative keratitis, presenting either as an isolated condition or as part of an underlying autoimmune disorder, has an estimated incidence of 3 per million per year.
OMG, I thought the disease is a new disease because I never heard the disease. But actually it's happened 1,000 years ago. Okay, so how the optometrist can diagnose the corneal ulcer? How can they know that problem is the corneal ulcer? Can you explain to us? Okay, next is how an optometrist diagnoses a corneal ulcer. So first, when you come to clinic, they will do a history taking and then they will do a slit lamp test where they will put the fluorescein into your eyes, just like this video. Oh my god, I forgot the next step. Now I want to call Brother Adib and Hilman to help me to diagnose this patient.
How is a corneal ulcer diagnosed? An eye doctor can diagnose corneal ulcer during an eye examinations. One test used to check for a corneal ulcer is fluorescent eye stain. For this test, an eye doctor places a drop of orange dye onto a thin piece of blotting papers. Then, the doctor transfers the dye to your eyes by lightly touching the blotting paper to the surface of your eyes. Then, the doctor uses a microscope called a slit lamp to shine a special violet light onto your eyes to look for any damaged area on your cornea. Corneal damage will show green when the violet light shines on it.
If you have an ulcer on your cornea, your eye doctor will investigate to find out its cause. To do that, the doctor may numb your eye with eye drops, then gently scrape the ulcer to get a sample for testing. The test will show if the ulcer contains bacteria, fungi, or a virus.
Alhamdulillah, thank you to Brother Hilman and Adib for help me to diagnose that person. Earlier, they said a lot about fungus, bacteria and virus. How this bacteria, how this infection is related to the corneal ulcer. I already know about the 6 chains of infection, I think. So okay, let me explain to you guys about the 6 chains of the infections. Now I will explain the 6 chains of infection. Firstly is the susceptible host. For this case, is the patient who get the sore of the cornea who get from the rub of your eye or extend the wear of contact lens. Second is infectious agent. For this case, is bacteria, fungi, protozoa, just like Ankylosing and the virus. Next is the source. Just like previously, is the thrush. And then the means of exit, the mode of transmission, and the means of entry. Just imagine the previous situation which you directly touch the trash and then you touch your eyes. That is the way the infection transfer into your eyes. So that's how the infection may cause the corneal ulcer based on the chains of infection. So how to avoid or break the chains of the infection? First, you can avoid to touch the dirty things and then touch your eyes. Second, you can avoid to wear the contact lens exceed the time limit and sleep with contact lens. And then you can avoid to wash your contact lens with the tap water which cause the acanthamoeba infection. These three was the main cause of why corneal ulcer can occur. So, if you already have the corneal ulcer, what you can do? Now, let's go to Brother HILMAN to explain how to treat the corneal ulcer.
Now, let's move on to what is the treatment for a corneal ulcer. Once your eye doctor discover the cause of the corneal ulcer, they can prescribe an antibacterial, antifungal or antiviral eye medication to treat the underlying problem. If the infection is bad, your doctor may put you on antibacterial eye drop while they test the ulcer scraping to find out the cause of the infection. In addition, if your eye is inflamed and swollen, you may have to use corticosteroid eye drops. During treatment, your doctor will likely ask you to avoid wearing contact lenses, wearing makeup, taking other medication, and touching your eye unnecessarily. In severe cases, the corneal ulcer may warrant a corneal transplant. A corneal transplant involves the surgical removal of the corneal tissue and its replacement with donor tissue. According to the Mayo Clinic, a corneal transplant is a fairly safe procedure, but likely any surgical procedure, there are risks. This surgery may cause future health complications such as rejection of the donor tissue, development of glaucoma, eye infections, cataracts, and swelling of the cornea.
Next, your doctor may also recommend some steps you can take at home to ease the symptom, such as put cool compresses on your eyes, but be very careful to keep water away from your eyes. And the second one is don't touch or rub your eye with your finger. And then limit the spread of infection by washing your hands often and drying them with a clean towel. And the other one is take over-the-counter pain medication such as acetaminophen or ibuprofen. Proper diagnosis is essential for optimal treatment. The causes of the ulcer is to be decided whether they are infective or non-infective. Bacterial corneal ulcers require intensive fortified antibiotic therapy to treat the infections. Fungal corneal ulcers require intensive application of topical antifungal agents. Viral corneal ulceration caused by herpes virus may respond to antivirus like topical acyclovir ointment instilled at least 5 times a day. Alongside, supportive treatment like pain medication are given, including topical psychoplegics like atropine or homatropine to dilate the pupil and thereby stop the spasm of the ciliary muscle. Superficial ulcer may heal in less than a week. Deep ulcer may require conjunctival grafts or conjunctival flaps, soft contact lens or corneal transplant.
Wait, before we end, we already prepared a simple video for you guys to easily remember the sign and symptom of corneal ulcer, as this symptom is very emergency and very dangerous where the disease can cause the blindness. So we hope when you see this video, you can remember the disease, and when you see the person who get the sign and symptom, please aware and please remind them to check to the eye doctor. So let's watch the video. That's all from us. Thank you.